When I think about my schooling as a psychologist, and I had a master's first in counseling psych, a lot of what I learned was what I call white therapy. Piaget, Erickson, Freud, the other Erickson, on and on. And I recently, in September, went to a conference on trauma and families, and Dr. Kenneth Hardy was speaking, and one of the things he said was he learned how to be a good white therapist. And he talked specifically about the fact that when you are a therapist, white or a person of color, you have to have that conversation, because I think if you have conversations with kids and families about their most painful issues, about what's happening in their families, what's happening for them personally, and you don't talk about race, you're almost saying, we can talk about anything but that. And when we start talking about that, I'm so uncomfortable that I don't see the intersection of how that plays out in your life on a daily basis. So I believe that we have to talk about those conversations and those topics really openly for people. So when people say, is there some racism in therapy? Absolutely. And I think you should say to a counselor or therapist, what's your experience with black women, if you are a woman? What's your experience with black children? What's your experience with black families? What's your position on? You are the consumer of mental health services, so you need to ask any question you have, especially if your plan is to pour out some of your most painful situations and some of the trauma you've been through. You should ask those questions.